We'll quickly look at the possible cancer growth that could actually occur in the lower GI tract, right? So we're talking about the lower gastrointestinal tract, right? So neoplasia of the lower gastrointestinal tract is what you're looking at, all right? And looking under this concept, what we'll be doing is we'll try to look at the types, try to look at the causes, we'll try to look at the symptoms, right? Try to look at the diagnosis, try to look at the treatment, possible treatment, and I think that will be all for what the lower GI tract, what neoplasias, right? That's cancerous growth in the lower GI tract. So let's have the overview. We see that neoplasia of the lower gastrointestinal tract actually refers to what? Abnormal growth or tumors in the colon, either the colon, the rectum, or the anus, right? So those are the last parts of the gastrointestinal tract. Those are the parts of the word lower gastrointestinal tract, right? So types of these tumors include the ones that could be benign, where you're talking about things like what polyps. We have adenomas, then we have what leiomyomas, all right? Then the ones that could be malignant, that's the ones that could be like they are spreading, they are metastatic. We have things like what colorectal cancer, all right, which can be detected using what a colonoscopy, all right. Then we have things like rectal cancer, anal cancer, then gastrointestinal what stromal tumors, right. So these are examples of what malignant tumors that we have, all right. So we have looked at malignant, we have looked at benign. Now let's go on talking about the possible causes of what tumors in the lower gastrointestinal tract. It could be genetics, where it's just what inherited through the family. It could be age linked. I would say that the risk is increased when the person hits what 50 years and above. It could be diet. It could be that the patient is taking low fiber diet and is taking very high fats, okay, in the diet. It could be lifestyle. That means you're having a sedentary lifestyle. You're not really active. You're not moving around. Okay. There's smoking too, right? Then inflammatory bowel disease. Inflammatory bowel disease is another cause, right? So what are the symptoms of this lower gastrointestinal tract? What if there's a cancer in the lower gastrointestinal tract? Of course, the person will be bleeding. And when they stool out, you see that there's blood in stool. All right. There'll be changes in bowel habit. There'll be abdominal pain. There'll be weight loss. There'll be fatigue. How about the diagnosis? We do things like what? Colonoscopy, flexible sigmoidoscopy. You do imaging studies like what? Computed tomography, magnetic resonance imaging, biopsy. All right, all of that could work. How about the treatment? Polypectomy. Polypectomy is a surgery where what? If you're having polyps, you can just what? Plug those polyps up. Okay. The surgical resection like colectomy, rectal resection, chemotherapy, radiation therapy, targeted therapies, right? All of that could actually help, all right? So that's it for this neoplasia of the lower gastrointestinal tract.